Obsessive-Compulsive Disorder (OCD) is a mental health condition that affects how a person thinks, feels, and behaves. One of its most distressing features is the presence of intrusive thoughts. Unwanted, repetitive ideas or images that can be disturbing and hard to control. These thoughts often go against a person's values or desires, creating intense anxiety and discomfort. While everyone experiences random thoughts from time to time, those with OCD struggle because they give these thoughts deep meaning and feel compelled to neutralize them through rituals or avoidance. Understanding the nature of intrusive thoughts is a key step in recognizing and treating OCD. Intrusive thoughts can take many forms, including fears of harming others, fears of being contaminated, doubts about morality or sexuality, or worries about safety. These thoughts are not a reflection of a person's true character or intentions, but rather a symptom of OCD's distorted thinking patterns. Unfortunately, the more a person tries to suppress or avoid these thoughts, the more persistent and distressing they often become. This can lead to a vicious cycle of obsession and compulsion that interferes with daily life, relationships, and overall well-being. Effective treatment for OCD and intrusive often includes cognitive behavioral therapy, NCBT, particularly exposure and response prevention, ERP, which helps individuals confront their fears without performing compulsions. Medication, especially selective serotonin reuptake inhibitors (SSRIs), can also be beneficial in retention of obsessive thoughts. Through proper treatment, support, and understanding, individuals with OCD can learn to manage intrusive thoughts and regain control over their lives. OCD and intrusive thoughts. Obsessive-Compulsive Disorder (OCD) is a mental health condition characterized by obsessions, unwanted, persistent thoughts, images, or urges and compulsions, repetitive behaviors or mental acts performed to relieve the distress caused by obsessions. Intrusive thoughts are a key feature of OCD and are often the most distressing part of the condition. These thoughts are unwanted, involuntary, and can be deeply disturbing. They often involve themes that are violent, sexual, blasphemous, or fearful, such as imagining harming a loved one, having inappropriate sexual thoughts, or fearing contamination from everyday objects. Even though these thoughts are not acted upon, they can feel very real and threatening to the person experiencing them. What makes intrusive thoughts especially painful for individuals with OCD is that they often directly contradict their morals, values, or sense of self. For instance, a kind and compassionate person may be plagued by recurring thoughts of violence, which can lead to intense guilt, shame, and confusion. Because these thoughts feel so foreign and unacceptable, people with OCD may question their own character, technology, even though the presence of these actually highlights how opposed they are to such actions. Another challenge is the repetitive nature of intrusive thoughts. They often return again and again, especially when someone tries to suppress or avoid them. This can create a cycle where the person becomes hyper-aware of the thought and responds with rituals or compulsions. Mental or physical acts meant to reduce anxiety. Unfortunately, these attempts to control the thoughts usually backfire, making the intrusive ideas even more persistent. Learning to accept the presence of these thoughts without reacting to them is a critical part of effective OCD treatment, and people with OCD often feel an overwhelming need to perform compulsions, repetitive behaviors, or mental rituals in response to their intrusive thoughts. These compulsions are meant to reduce the anxiety and distress caused by the obsessions or to prevent a feared event from happening. For example, someone plagued by intrusive thoughts about germs may wash their hands repeatedly, while another person who fears causing harm may check locks or appliances over and over to ensure safety. Mental compulsions, such as silently repeating phrases, praying, or mentally reviewing events, are also common. These actions can take up significant amounts of time and energy, severely interfering with daily functioning, relationships, and quality of life. While performing these compulsions may provide short-term relief, it ultimately reinforces the OCD cycle. Each time a compulsion is completed and anxiety temporarily decreases, the brain learns that the ritual is necessary to prevent danger or to feel safe. This strengthens the connection between the intrusive thought and the compulsion, making the cycle more entrenched over time. The person becomes increasingly reliant on rituals to manage their distress, and their sensitivity to intrusive thoughts intensifies. The more the compulsions are used to avoid or neutralize distress, the more power the obsessions gain, leading to a greater frequency and intensity of intrusive thoughts. Breaking this cycle is one of the main goals of OCD treatment. Exposure and response prevention (ERP) therapy is a highly effective approach that involves gradually exposing a person to the source of their fear without allowing them to engage in compulsions. Over time, this reduces the anxiety associated with the intrusive thought and weakens the compulsion response pattern. Through ERP and other therapeutic strategies such as cognitive restructuring and mindfulness, individuals learn that intrusive thoughts are not dangerous and do not require action. Though challenging with the right support and treatment, people with OCD can gain control over their symptoms and significantly improve their quality of life. Treatment for OCD, particularly when intrusive thoughts are present, typically involves a combination of therapy, medication, and lifestyle strategies. The most effective form of therapy is cognitive behavioral therapy (CBT) with a specific focus on exposure and response prevention (ERP). ERP helps individuals gradually face the situations or thoughts they fear without engaging in compulsive behaviors. For example, a person with contamination fears might be encouraged to touch a doorknob and then resist the urge to wash their hands. Over time, this exposure reduces anxiety and weakens the link between obsessions and compulsions. CBT also teaches people to recognize distorted thinking patterns, challenge irrational beliefs, and develop healthier ways of interpreting intrusive thoughts. Medication is another vital tool in treating OCD, particularly for those with moderate to severe symptoms. Selective serotonin reuptake inhibitors SSRIs such as fluoxetine Prozac, sertraline Zoloft, and fluvoxamine are commonly prescribed. These medications help regulate serotonin, a neurotransmitter involved in mood and anxiety regulation. While SSRIs may take several weeks to show full effects, they can significantly reduce the intensity and frequency of obsessions and compulsions for many individuals. In some cases, higher doses than those typically used for depression are required to effectively treat OCD. Medication is often most effective when combined with therapy, allowing for a more comprehensive and sustainable recovery. In addition to therapy and medication, mindfulness practices have proven beneficial for people with OCD. Mindfulness involves staying present in the moment and observing thoughts without judgment or attachment. This skill is especially helpful when managing intrusive thoughts, as it teaches individuals to accept their presence without reacting to them emotionally. Thanks for watching. Stay kind, stay curious, and take care of each other.